Here are some causes of skin disorders. Bacteria trapped in skin pores and hair follicles. Bacterial folliculitis. This common type is a rash of itchy, pus-filled bumps. It occurs when hair follicles become infected with bacteria, usually with Staphylococcus aureus.
Other causes of skin disorders are the fungus, parasites, microorganisms on skin. Skin diseases can be caused by viruses, bacteria, fungi, or parasites. Staphylococcus aureus and group A beta hemolytic streptococci are the most common bacterial skin pathogens. Herpes simplex is the most common viral skin disease of the dermaphytid fungi. Trichophyton rubrum is the most prevalent cause of skin and nail infections.
Another common cause of skin disorders are viruses. Viruses cause viral infections. These infections range from mild to severe. Different types of viral infections include shingles or herpes zoster, chickenpox, molluscum contagiosum, warts, measles, and hand, foot, and mouth disease. These skin disorders can be treated by proper care and medication.
The cause of skin disorders are the weak immune system. The immune system guards against infection in the body. A compromised immune system may make a person more susceptible to illnesses. The body's immune system compromises white blood cells, antibodies, and additional elements including organs and lymph nodes. Numerous diseases can impair immunity and make someone immunocompromised. These conditions might be moderate or severe. Others are the product of environmental influences, while some are present from birth. People with compromised immune systems are more likely to get sick frequently and display severe symptoms.
Contact with allergens, irritants, or another person's infected skin. Contact with another person's allergens, irritants, or infected skin is a further cause of skin disorders. Contact with chemicals or other irritants frequently causes the disease. These compounds can potentially create an allergic reaction that results in itchy, irritated skin. The majority of contact dermatitis instances are mild. However, the usual treatment involves applying topical lotions and avoiding the irritant.
Genetic factors. Skin diseases affects the skin and its projections, some of which can be inherited from your genes. Such conditions are mainly caused by single gene mutations and result in skin cancer, acne, lupus, psoriasis, hives, warts, and carbonicles. Many rare skin diseases are genetic, meaning you inherit them.
There are illnesses affecting the body systems that cause skin disorders, such as inflammatory bowel disease. This kind of bowel disease primarily causes skin disorders because of the reaction of the medicine to cure this disease in the body. Some skin problems caused by this particular medicine are skin tags, anal fissures, stomatitis, etc. Another example of illnesses affecting the body systems that cause skin disorders is diabetes. Diabetes causes skin problems such as bacterial infections, fungal infections, because this kind of disease can increase the risk of infection and blood circulation problems. And the last example is lupus. Lupus is an inflammatory condition that can harm the body's skin, joints, or internal organs. Typical lupus-related skin issues include round lesions on the face and head.
Another common cause of skin disorders is pregnancy. Normal hormonal changes during pregnancy cause common skin conditions such as stretch marks, melasma, hyperpigmentation, and eczema. These pre-existing skin problems change or worsen during pregnancy but usually go away after the baby is born.
Lastly, we have the sun. Sunlight exposure causes early aging of the skin. It can cause many skin disorders such as moles, wrinkles, sunburn, and photosensitivity. Sun can cause or worsen your skin disorder, so it's best to treat it properly.
Here are the examples of diseases and disorders of the skin. Ringworm. Ringworm is a common skin infection that is caused by a fungus. It is called ringworm because it can cause circular rash shaped like a ring that is usually red and itchy.
Another example of disease and disorder of the skin are eczema and dermatitis. Eczema, also called atopic dermatitis, is a condition that causes your skin to become dry, red, itchy, and bumpy. It's one of many types of dermatitis. Eczema damages the skin barrier function. This loss of barrier function makes your skin more sensitive and more prone to infection and dryness.
Another diseases and disorders of the skin is psoriasis. Psoriasis is a skin disease that causes a rash with itchy, scaly patches, and most commonly on the knees, elbows, trunk, and scalp. Psoriasis occurs when skin cells are replaced more than quickly than usual. It's not known exactly why this happens, but research suggests it's caused by a problem with the immune system.
Next one is the impetigo. A minor infection known as impetigo can develop anywhere on the body. It typically affects exposed skin near the mouth and nose, on the arms, or on the legs. Impetigo begins as red sores or blisters, though brown and black skin may make the redness more challenging to discern. Quickly rupturing sores or blisters leave behind crusty, golden brown patches. The patches may resemble cornflakes adhered to skin in some ways. Another one is the decubitus ulcer. The terms pressure ulcer, bed sores, and decubitus ulcers are interchangeable. It is an open wound on your skin brought on by prolonged, consistent pressure applied to a particular body location. It is an injury to the skin and underlying tissue brought on by persistent pressure. The skin covering bony parts of the body, such as the heels, ankles, hips, and tailbone, is where the decubitus ulcers most frequently appear.
Next is robeola and rubella. The virus that causes robeola, or also known as measles, causes skin sores that can develop pneumonia or damage the brain when infected during pregnancy. Rubella, or also known as German measles, which also causes skin lesions and is typically mild through the respiratory tract and can be harmful since the virus can pass through the placenta and harm the fetus.
Chickenpox. Varicella zoster virus, or VZV, causes chickenpox infection. Chickenpox, also called varicella, is characterized by itchy red blisters all over the body. It often affects children. Most cases occur through contact with an infected person. The virus is contagious to those around you for 1 to 2 days before your blisters appear. The virus can spread through saliva, coughing, sneezing, or contact with fluid from the blisters.
Shingles or herpes zoster. The reoccurrence of this varicella virus induces shingles or herpes zoster. It is the same virus that causes varicella or chickenpox. After a person has chickenpox, the virus lies dormant in specific nerves for many years.
Another example is cold sores or fever blisters, which are tiny fluid-filled blisters on and around your lips. These blisters are often grouped in patches. It is transmitted by oral or respiratory routes.
Lastly, genital herpes is a common sexually transmitted infection caused by the herpes simplex virus. The primary way of receiving this disease is by sexual contact.
Here are some ways to take care of your skin. Protect yourself from the sun. You can reduce your risk of sun damage and skin cancer by staying in the shade under an umbrella, tree, or other shelters. Your best bet to protect your skin is to use sunscreen or protective clothing outside, even where you're in the shelter.
The other way is don't smoke. Quitting smoking can improve your appearance. As blood flow gets better, your skin receives more oxygen and nutrients. This can help you develop a healthier complexion. If you stay tobacco-free, the stains on your finger and nails will disappear.
Next way is proper skincare. To prevent skin issues and problems, always take care of your skin properly. Here are some following ways and suggestions for proper skincare. Limit bath time, avoid strong soaps, shave carefully, pat dry, and moisturize dry skin.
Next, eat a healthy diet. A nutritious diet may aid in the prevention of several serious illnesses like type 2 diabetes, heart disease, and stroke. Furthermore, it might lower your risk of getting some malignancies. Eating a balanced diet may speed up your recovery time if you get sick. Eating a well balanced diet is another key strategy for preventing fat and overweight. Along with a nutritious diet, regular exercise is crucial for maintaining good health and preventing or reducing obesity.
Next, manage stress. Uncontrolled stress can increase your skin sensitivity, lead to acne breakout, and cause other skin issues. Manage your pressure to promote healthy skin and a healthy state of mind. Get enough sleep, establish realistic boundaries, reduce your to-do list, and carve off time for your favorite activities. The outcomes can be more striking than you anticipate.
Skin treatment from disorders. Antihistamines. Antihistamines are medicines that treat allergy symptoms by blocking the effects of histamine. It relieves the itch and brings down swelling in your skin. Antihistamines come as pills, chewable tablets, capsules, liquids, nasal sprays, and eye drops. These are also injectable forms used mainly in healthcare settings. Antihistamines are medicines that can treat eczema. Some antihistamines also help you sleep. These medicines won't stop eczema flares, but they can break the cycle of itching and scratching that makes flares worse. The sedative in some antihistamines relaxes you and makes you sleep. By helping you sleep, these medications help you from scratching your skin during the night and irritating it even more. Medicated creams and ointments. Prescription skincare can improve the overall look of your skin. Prescription products often contain the same ingredients as over-the-counter products, but dosage strengths are higher in prescription skincare. Some common topical treatments for skin conditions include antibacterials, antheralin, antifungal agents, benzoyl peroxides. Antibiotics. Antibiotics are used for systemic and topical skin diseases treatment, taking advantage of their antiseptic, bacteriostatic, and also their anti-inflammatory and immunomodulating properties. In case of localized external skin layers infections, a topical treatment is adequate. In case of widespread and deeper infections, a systemic treatment is needed. The latter dermatological diseases are commonly treated by beta-lactam antibiotics or penicillins and cephalosporins, macrolides, and tetracycline.
Vitamin or steroid shots. By steroid shots, large cysts can be shrunk and inflammation can be temporarily relieved with it. The injection is injected directly into a cyst or nodule of acne where both the face and the body may be treated with the injections. Also, vitamins that can be injected, such as vitamin C, can enhance keratinocyte differentiation and reduce melanin formation, providing antioxidant defense against UV-induced photo damage. Laser therapy. Laser therapy helps skin problems such as scars, excess hair, and wrinkles, and it can also treat brown spots, redness, or discoloration of the skin. It even tightens the skin and encourages collagen production, which is good for our skin. Targeted prescription medications such as hydrocortisone ointment reduces skin irritation, rashes, redness, and inflammation of the skin.
Another example is medicated makeup. You can also treat skin disorders by utilizing medicated makeup, since medical makeup corrects skin tone imperfections with dermocosmetic products, which bring tolerance, efficacy, color neutralization, and sun protection. One example is the hypoallergenic makeup brands Neutrogena and Clinique. Another treatment for skin disorders is over-the-counter skincare products. OTC skincare products can support general skincare needs such as cleansing, hydration, and sun protection. Examples are Cetaphil's Cleanser and Nature Republic's Aloe Vera Soothing Gel.
Another treatment from skin disorders is good hygienic practices. Good personal hygiene is one of the best ways to safeguard oneself from skin diseases and disorders. The best practices include washing your body every day, using soap to wash your hands, brushing your teeth twice a day, covering your mouth when you cough or sneeze. Maintaining proper personal hygiene will also aid in preventing the spread of sickness to others. Lastly, is small lifestyle adjustments. Sometimes, doing treatments to our skins won't work until we fix our lifestyle, so it's best to adjust to have healthy skin. Some of these are examples of a small lifestyle adjustments in which helps you treat your skin like exercising daily, have a balanced diet, get enough sleep, and reduce stress at all times.